love it. And I've got to say, I've loved getting involved with the chamber, and what you guys have been doing to revitalize it. We were one of those kind of placeholder members for quite some time,
Sure,
where
sure.
we had the presence on the website, but didn't do much with it. And then with all the work over the previous year and how the hits started coming in, we started getting calls, and we realized we had one of our admins' cell phone number and home address as the profile. And so she started getting all these calls, and we're trying to figure out where are they coming from. And it was coming from the chamber website. So shout out to the traffic, but we realized, man, we really got to update this
Make sure the
profile and do
information is,
something with it.
is updated. Welcome to United We Podcast, the official podcast of the United Corpus Christi Chamber of Commerce, the only chamber podcast in South Texas. I'm your host, Al Ariola Jr., and we're here to explore the latest business insights, community stories, and opportunities shaping the coastal bend. Whether you're a business owner or just passionate about our region, you're in the right place. Let's dive in. Welcome back, Chamber family and friends, to United We Podcast. Today we are joined by Jeremiah Nasiatka from UnitedHealthcare. Thank you for joining us, Jeremiah.
Yeah, thanks for having me.
Hey, so before we talk a little bit about UnitedHealthcare, let's get to know Jeremiah and your career path into UnitedHealthcare. How did you get into this company, this organization?
Sure. So I've been with United since 2017. Started in San Antonio as a market manager, supporting our local agents who represent our Medicare plans across the city, and then grew from there. Now handle Central Texas, representing a team of managers and over 3,000 agents who represent our Medicare Advantage plans and help educate consumers on that. So prior to coming to United, I actually worked with insurance, but on the other side of the table, I started a restoration company in San Antonio, was building that.
Okay.
So we were billing the insurance, and then
Gotcha.
the previous director in San Antonio, it's just amazing how career paths work.
Yeah.
You get to know somebody, and it's all about connection, right?
course.
And her house flooded, and I was the operations manager on her job for about 6 months, and she said, "Hey, I have an opening. Why don't you come on over?" And I don't think anybody wakes up saying, "Hey, I'm going to sell insurance for a career."
Sure.
But no one's born that way. But you come into it, and I've just found that I absolutely love it. You're able to make a difference in people's lives, educate on a really confusing topic, and support thousands of small business owners, the independent insurance agents, the independent brokers who, are really starting their own businesses throughout Corpus Christi, the Coastal Bend area, and really all of Central Texas.
So you brought up the broader context of all types of insurance, but now specifically you're obviously now in the healthcare space.
Yes, yeah. So was working more on the property and casualty side now, specifically focused on Medicare. And that's what I handle for UnitedHealthcare in Central Texas.
Well, and Medicare. So for the audience, if they don't understand all the nuances of that Medicare health insurance itself, can you explain just the concept of Medicare?
Sure. So Medicare is the federal health insurance for 65 and older, or those who are permanently disabled. It's not income based. It's based on age. And so there's various parts of Medicare. You've got your traditional Medicare, Part A and B. You've got your Part D, the prescription drug side, and then various options to cover really the remainder, because traditional Medicare is solid health coverage, but it's a 80%, 20% coinsurance type coverage. So there's no financial safety nets, and we know with inflation those costs continue to go up. So 20% of a hospital stay, 20% of a surgery can get pretty high. And so what UnitedHealthcare and other companies do is provide those options to provide that insurance over and above that traditional Medicare A and B to give consumers a peace of mind, financial safety nets, maximum out of pockets, that sort of thing, to be able to add some predictability, as well as some additional benefits and management to the health insurance space.
Well, you explained that very well. Thank you for that. Well, and I guess can you explain some of those supplemental products? I guess is that what you're
Sure.
describing?
So really, someone who's coming into Medicare, and our agents can say this so much better than I can, but someone who's coming into Medicare, maybe they're turning 65, they automatically qualify for Part A. They sign up for Part B through Social Security. And then they really have two choices on how to cover that extra 20%. So one option is a Medicare supplement, and those are at the state level through various insurance companies, and they're premium based. You pay a premium, then that covers that 20%, and the plans base their premiums on the medical costs coming in. A lot more traditional insurance model. With the rising cost of medical care and the inflation, those premiums have seen some pretty significant height rakes over the last couple years. And so we've seen a big growth in Medicare Advantage. And actually, Corpus and the Coastal Bend area, now 52% of Medicare beneficiaries are choosing Medicare Advantage, so more than 1 in 2.
Gotcha.
We crossed the 50% threshold in early 2024, and that's gone up. And what Medicare Advantage is it basically combines the various parts of Medicare. You've got your A covering your hospital, your B covering your doctors, D covering your prescription drugs, and it combines those all into one
can I
privately managed health plan.
Can I ask, what happened to C? Is there ever
So
was there
Medicare
ever
Advantage
C?
is actually known as Part C, which is
Okay.
funny. And so you've got A, B, and D combined into C.
Okay.
But and it's one privately managed health plan. So instead of showing just your Medicare card and then your Medicare supplement to cover that overage, what Medicare Advantage does is it basically acts similar to like an employer health plan where you're going to show your Humana card or your UnitedHealthcare card at the doctor. They're going to bill United for those services. And the plans are really incentivized with Medicare Advantage to keep members healthy, keep them out of preventable hospitalizations. So the plans include additional benefits like gym memberships at no cost, dental care, because taking care of your teeth, taking care of your eyes, your hearing, all big factors in staying healthy, particularly as you age. And so a lot of members choose Medicare Advantage because of the lower cost, but also because of the additional benefits like dental, even healthy food on some plans where there's credits to go buy healthy food at the grocery store.
Well, and it sounds a lot like you're trying to genuinely promote healthcare. I think what often happens in South Texas is not a lean in or trending towards more emergency care, like waiting for it to happen versus preventative.
Correct. It's all about preventative, and so we work with some great provider partners hand in hand. It's you hear a lot in the news about value-based care, and it's really working toward outcomes, working versus just billing based on how many procedures or how many medications you're dealing out. And so we work closely with WellMed Medical Group here is one of our biggest partners. They've got 15 locations across Corpus and the Coastal Bend area. They've actually got a grand opening coming up over the summer. I know the Chamber will be involved in that,
Yes,
so
yes,
excited about that.
We do well at those ribbon cuttings, yes.
Yes. And so they've got over 50 providers just in those clinics, working, and again, preventative, right? Because if you can deal with issues on the front end, if you can get blood pressure and A1C and everything else under control on the front end, you're going to prevent those crises.
Yeah, and you mentioned connecting to the community, explaining these opportunities. You have also another, I guess, storefront facility.
Yeah, so in cooperation with WellMed, we actually run a Medicare Information Center at the HEB on Castores, 4444 Castores.
Okay.
And that's open 9 to 5 every day, Monday through Sunday. We've got our team supports about 350 independent insurance agents or brokers across Corpus and the Coastal Bend area. And we have them staff that location. So some of our most trusted brokers are in that location. They're able to answer questions, help people navigate really anything, even if it's hey, I got this letter, or I have this stack of mail, I don't really know
Understand it.
what's important, what's an ad, what's something from my carrier. and the agents are more than happy to just sit down and help people sort through.
Well, and I'm sure even some are percentages like what is what and what is what. I mean, kind of even to the spirit of our conversation earlier.
Yeah, it's amazing the amount along with the growth that's come with Medicare has come an amazing amount of marketing and confusing information as well. We saw a big shift during COVID to big national call centers and a lot of 1-800 number. You see a lot of the ads on TV, and you go on any local access station during AEP, the annual enrollment period for Medicare in the fall. And I mean, seniors' mailboxes are overflowing. Their emails and the TV ads are all over the place. And so our team really works to support those local agents who sit across the kitchen table, can share their cell phone, can be available for text messages and phone calls, and can really help navigate through all that and answer the questions and be a trusted source.
That's a good deal. And I mean, obviously that space is working.
It's very well. So we've continued to grow. So I mentioned the 350 agents. Those 350 agents support over 46,000 Medicare Advantage members in Corpus Christi.
area.
And that's about representative of about a 63% market share of the Medicare Advantage business, and that's with 10 competitors.
That's
So,
a pretty big market.
yeah,
share.
it's big, and I gotta say I love speaking in front of this U. I'm really used to speaking in front of these big U's.
I kept on noticing
works,
you
the
noticed my
United, yes.
lapel, and we
I
have.
almost wore a very similar one because our logos are very close.
They are very close, and we have had some commentary that our logo looks like the UnitedHealthcare logo. But I'm glad you kind of flipped the microphone this way. Is our logo does kind of have some meaning too. So the two symbols right there, the gray, that's our Hispanic chamber, and the greater chamber forming now the United chamber that is up and flying. And
I love it, and I've got to say I've loved getting involved with the chamber, and what you guys have been doing to revitalize it. The website definitely works. So we were one of those kind of placeholder members for quite some time,
Sure,
where we had the presence on the website, but didn't do much with it. And then with all the work over the previous year and how the hits started coming in, we started getting calls, and we realized we had one of our admins' cell phone number and home address as the profile. And so she started getting all these calls, and we're trying to figure out where are they coming from. And it was coming from the chamber website. So shout out to the traffic, but we realized, man, we really got to update this.
Make sure the
profile and do
information is
something with it.
is updated. Yeah, no, we've had that happen too, where members signed up, they put their cell phone, and they're like, they couldn't sort out where that was happening, why they were getting so many calls on their cell phone, and then they realized it was in their profile, and that was populating the website. So yes, the website does work. The traffic
It works, and it definitely got us re-engaged, and I can say it's been a fantastic experience.
That's good to hear.
Jumping back in.
No, yeah, and thank you for your chamber commitment. And to your point, I think, like you mentioned, you just maybe just had the membership. I feel like now you guys are taking advantage of the membership.
We are, and we're looking at how we can serve them better too. So one of the things that we've really been leaning into in Corpus Christi is a chronic special needs plan and growing that. And those are plans specifically designed for people who have diabetes and heart conditions, which is a big
thing in
issue,
this,
down in this area. And so we just expanded. It's been here in Corpus for a while. This year in 2025, we just expanded that plan out to 4 new counties: DeWitt, Goliad, Calhoun, and Refugio. And we've really seen that grow. And what those plans do is they provide an extra level of support. You've got prescription drugs and that formulary, that drug list specifically built around those conditions. And the plans have the extra back end support, the nurse lines and the management to really help stop the cascade of those conditions. Because I mean, we've all had parents who age and get those chronic conditions, and one condition becomes 3 and becomes 5 and just quickly affects the quality of life. And the idea of these plans is to help these most vulnerable members, and their plans specifically designed for those conditions, and help slow that that process and help them live better, healthier lives, including like healthy food and those sort of things that we can offer on these special needs plans and the way they're classified.
Well, yeah, I'm glad you brought up the essentially a lot of our population is we're not, I don't want to say known as a retirement town, but we do have an older population, and I think your service is obviously pretty important to the economy in a lot of ways.
Definitely. I mean, healthcare is a huge part of the overall economy, and just really living healthy. I mean, you talk about what is success, and success is health. Success is wealth. Success is several things, but health is, if you don't have your health, what do you have? And
Right.
and so really diving into staying active, being healthy. One thing I want to do as we get more involved with the chamber over the next year is highlight some of our local agents, the ones who own agencies here. They've got offices around Corpus, where we're going to kind of be their umbrella in the chamber, but we definitely want to highlight their work because they're working with seniors across Corpus and the Coastal Bend every day, helping hundreds or thousands of them a year. Just answer questions and be that trusted resource in the midst of all the confusing noise.
Well, and you brought up connecting with the chamber, using the chamber. Thank you. You've sponsored our breakfast. You guys are certainly very engaged in connecting our membership to each other, and obviously connecting to our membership. Where have you found? You've mentioned some value that you found in the chamber. Is there anything else that you've kind of enjoyed?
Well, I'm really looking forward to connecting with other business leaders here, particularly in the smaller businesses, because there's a place for the individual Medicare plans to help out in the small group health space as well. If you've got for your smaller business owners, if you're paying for a health plan for your employees, a lot of time that's a cost share. It's this level funded group. And if you've got employees who are older, they could be paying pretty high premiums.
Right.
And it may be advantageous for them to go on an individual Medicare plan for the employee as well as for the employer.
Gotcha.
Because they are going to you're gonna lower that age, and you're going to lower the overall cost of your plan.
Is that a statistic that you're finding? Is that like especially like maybe with a group employer base, if they have someone over 65, that they're not taking advantage of like maybe some?
A lot of times they don't know, because a lot of times their group broker, it might not be something that they mention because they're not looking. A lot of people who are doing like the group health insurance plans don't do Medicare. There's not a lot of crossover in that space. And so we're working to really connect on the financial advisor side, the group health insurance side, with the individual Medicare. So there's that clear transition. So just a lot of education.
Sure.
But what we are seeing is as health insurance in general becomes more expensive, a lot of people are choosing, and the marketplace plans and everything like that, a lot of people are really looking at, hey, how and when can I get on Medicare? Because Medicare is still strong. It's very affordable comparatively to a lot of these small group plans or your marketplace options, because we've paid into it.
Gotcha.
We've paid into it all this time, and it's really waiting for you when you turn 65.
Well, Jeremiah, I thank you for the wealth of information that you just shared. You actually just educated me on a few things that I otherwise didn't know. Before we leave the audience, is there any kind of shout out you want to give, or any kind of special acknowledgement?
Big shout out to it's just some of our agency partners here. I hesitate to give names because I'm going to forget somebody.
Sure.
But really, that I want that to be our focus. Is we're going to lean in and really highlight some of our agents and the agencies that they've created and what the difference they're making in the community, and just present them as resources to the community. I think we're excited to be able to promote them and to connect with other members of the chamber and just get more involved in the Corpus Christi area as a whole.
Jeremiah, once again, thank you for your time. I want to thank the audience for joining us. We'll see you again next time.